Hello. Alright, this impromptu video, I had prostate surgery, robotic prostate removal, okay, and I had it Monday. Today's Friday. So I'm just here to let you know what I'm going through, how it took place. And this way, because I didn't know any of this that I'm about to tell you, I didn't know any of this beforehand. I didn't know what to expect. So I really went in almost cold, I'll tell you about that. But I think it's good to pre-plan and also to get any worries out. Don't be worried about it. If you have to have it done, get it done. And for anybody who's watching and you have not had men, if you haven't had the PSA test, get the PSA test. Let, and talk to your doctor how often you need that or what age you need to get started getting it. Get it done. Don't let prostate cancer linger. Okay. I had a PSA test real quick. I've been taking PSA tests for years. At least 15, 16 years. A friend of mine told me, get your PSA done. He was adamant. And I had, up to that point, I had not done it. I was almost to 50, and when he told me. But a year later, I started getting my PSA test, and I've been tested all along. A couple years ago, it was elevated, and they had me come back, and it was down below normal levels. Okay? I'm not a doctor. I'm not professing to be a doctor. I'm not professing to be smarter than the doctors, but it's a possibility I had the makings of prostate cancer then. But I was relieved the second test was low. So, But then last year, it was elevated. They did it again. It was elevated. They scheduled me for a biopsy. If you've been to the biopsy, you already know what I'm talking about. Where the urologist has to go in and take sections of your prostate gland, 12 sections, all around, and they found cancer in 3 of them. They did, I don't know what kind of test it was, I forget the name of the test, but it was a test to see how radical this cancer was, how strong it was, how was it going to grow fast, and there are different levels, and I guess mine was a slow growing. And then there's levels too. You need to talk to a doctor about this. There's levels of the cancer. I believe mine was a 6. So it wasn't scheduled to spread, and one doctor even told me, you can just wait it out and, get a biopsy every year and see how it's going. I didn't like that. I didn't want the cancer in me. Okay? So I talked to other friends of mine and that have had it done. My brother has had it done. Just get it out. Okay, so, but then there was the coronavirus. Okay, I wasn't going in the hospital with the coronavirus. I just, no. But when they came out with the vaccine, I got a vaccine, and as soon as I got the vaccine, I scheduled surgery. That's a 3-month wait. But fortunately, then they had soon after I made that appointment for July, they had an appointment here on June 21st when I had my surgery. And I talked to my doctor, video conference with the surgeon, and he actually told me, start doing Kegels now. And I knew what Kegels were. And where you're exercising. He gave me a spiel about Kegel. That means hold it tight, like you're holding your pee in, tight for 10 seconds, let it go. Do that 100 times a day. Well, that's a pretty aggressive schedule for exercise. Now, but I started doing it. And I hope that helps, because now I have to be faced with incontinence. I probably have to wear pads for a while. And I'm doing the Kegel now, you know, so just as a side note, I teach line dancing. I teach a line dance aerobics class up until the coronavirus started last March. For years I taught a line dance class, and I'm scheduled to go back in second week of September. Hello, here it is June. My surgery was June 21st, and I'm scheduled to go back teaching a line dance aerobics class. Well, I want to try to get as back to normal as possible by then. I don't know if it's possible. Who knows? Will I be wearing a pad? Will I be wearing Depends? Who knows? I don't know at this time. Probably yes, and probably for the first month of my class, I will still be taking it easy. I'll probably be barking out more orders than I'm actually doing. Okay, so anyway, I'm here to tell you what to expect. Okay, the surgery. Before the surgery, they told me last Friday, I talked to the office, and they told me you want to wear loose clothes. Forget about your whitey tighties. Forget about them. For now, forget about them. Get some boxers. If you already have some, that's good. Loose boxers. Loose clothes. You want to wear loose clothes to the surgery. Again, they will tell you all this. I'm just telling you what I went through. And you want to be clean. Okay, to me, so that weekend before, I trimmed my nails, trimmed my toenails, shaved, gave myself a haircut. Just as a side note, no matter what you do in life, you'll be treated better if you're well groomed. Okay? I don't care what color you are, what your state of art is, what your state of mind is, you will be treated better if you're groomed. So, anyway, and she told me to shower that morning of the surgery with an antibacterial soap. I said, well, they don't really sell that anymore. And I'm thinking the soap with, and I might pronounce this wrong, triclosan. I know Dow liquid used to have that in it, antibacterial, but she said, no, Dow bars, you can still get antibacterial. And they have a different antibacterial agent in there now. So I got some Dow soap. So this is the one thing you'll want to get before your surgery. You know, if you're watching this and you still got 2 weeks or a month or whatever, start stacking up on water. Get the soap, Neosporin, food, okay, laundry detergent. Get those things. Have those things already, because you can't. My doctor told me I'm not supposed to lift 20 pounds for the next 30 days. So, as far as dentures, they told me don't bring your dentures, don't bring anything that you have in your mouth that can come out. So I left those at home. Fine. I wasn't trying to be Mr. America or GQ going into the hospital. You want to have your car. You won't be able to drive for 2 weeks, at least. Okay, you don't want to drive with the catheter in. I'm giving it to you straight. Okay, you don't want to drive with the catheter in. And so make sure your car is safely parked, or maybe you share it with somebody else, with your wife or your partner. And that's fine. Okay, but I'm just letting you know, you're not going to be driving. Okay. They gave me Vaseline at the hospital, but I also got Neosporin. Okay, so I go into my surgery. I go in and, you know, they do the paperwork. I had to be there at 5:30, 5:15 that morning. So I go in, and there's other people there waiting for surgery and everything, and they were very efficient there at 5:15 in the morning, and had me go in a couple different offices and do the paperwork. They're going to ask your name and date of birth every time you go in talk to a different person. Okay? So that's to make sure that they're talking to the correct person. So don't get frustrated over that. So I go in, and once they have me sitting there and waiting, then they call my name, and I go to the room, strip, put the hospital gown on, get in the bed. They're drawing blood, they're doing this. IV. Okay, if you're scared of needles, don't be. I might be scared of needles, but you know why I'm not? I don't look at them. Don't look at it. Got the IV? She said there's going to be a pinprick? Fine. Do it. I'm not watching. Don't watch. Anytime I get a shot, a vaccination, just don't look. That's how you get over your fear of needles. Don't look at it. Okay, I don't even know what a needle looks like nowadays because I don't look. So this is the funny part. I get into bed, the surgeon comes and talks to me, gets me ready for things that will happen, and the anesthesiologist comes and talks to me. And he tells me he's going under general anesthesia, asks me all the questions, am I allergic to anything? Have I ever gotten sick from anesthesia and all? I said, this is the first time I've been in the hospital ever. Actually, since I was an infant, I had eye muscle surgery, but I don't remember that, of course. But, so I don't think so. So he told me they're going to stick a breathing tube in your throat while they're doing the surgery, and so when you wake up, your throat will be a little scratchy for a couple days, and it was nothing major, it wasn't anything. And then they wheeled me out, and 2 or 3 of them wheeled me down the hall, I think about 30 yards from what I recall, down different hallways, and they get into the operating room, and it's real bright, extremely bright, lights everywhere. There's 10 to 12 people in this room from just me looking around because I'm all curious of what's going on. I see the robot in the corner. I see about 5 or 6 people taking plastic off or, getting the robot ready. So I want to just look around, but they picked me up, put me on the operating table. I was out. I don't remember anything else. I was out. So the funny part about that, I'll skip to the next day. The anesthesiologist came back in to see how I was doing, asked me all these questions. Did I have any problems with the anesthesia? Was I nauseated? I said, no, none of that, no. About my throat, yes, it's a little scratchy, but it's okay. It's not as bad as when you catching a cold or anything, no. And I probably can still feel that, but it's really nothing, as far as I know. But anyway, and I told him about my experience in the operating room. I said, I was out before they even put a mask on. He said, well, I think they put a little something in your IV. I said, oh, that makes sense. Because I was out. As soon as they lifted me on the operating table, I was out. And I said, there you go, that makes sense. So, after surgery, I don't remember much about the recovery room. I remember my wife being there when I woke up, or the nurse was there. And the hospital was great. I mean, they did everything. I woke up. Now, for the first time in my life, I have a catheter in. Okay? Got a catheter in my penis. Okay? I had no pain. The discomfort I had was the catheter caused the catheter. If you go to, there's plenty of YouTube sites where you can go to and see what the robotic surgery does. The catheter is there because they actually have to take the prostate gland out, which is attached to the bladder, and now they have to piece together the line where your pee comes out. Catheter is up against that to protect it and let it heal for about 10 days. And so I have a catheter in. The nurse immediately starts to explain that my pee is going into this bag, and don't make any sudden moves. Don't try to get up because you're still attached to the IV. Still attached to the catheter on the right side. So you just lay there. They had balloons under my, I don't know what they call them, but you know, balloons that inflate like every 20 seconds. And that keeps your legs from getting bedridden, you know, weary and everything, and keeps the blood flowing. And under my back. So I'm like that. I'm thinking probably from 11 or 12 that morning, Monday morning, until about noon the next day when they released me. I forget what they fed me on Monday, but I was eating. I had no pain. I'm telling you, the only thing I had, they come in and ask you, are you in pain? What is your pain between 1 and 10? I said, you know, I feel the staples. That's maybe a 1 or 2. There's nothing there. I said, the discomfort I'm having is from the catheter, or that I have to pee. I can't pee, but I gotta pee. Okay, that is because the catheter is up against your bladder. The bladder is sensitive, and it thinks that there's pee ready to come out. So, anyway, and I said, I wouldn't call it pain, it's discomfort. Now the discomfort is high, 7 or 8. I'm going to say the discomfort because I really couldn't sleep. You can't sleep when you have to pee. So that's just something I went through, but there's no pain. I've got 4 staples in and even over my navel. And I know they're there, and I feel them when I bend over or anything, but it's not pain. I haven't taken any pain medicine since I've been home. She gave me some to help relieve the discomfort from the sensation to pee. She gave me some, I forget the name of the, Tropidol, I don't know. They're in the hospital, but since I've been home, I haven't had to take any pain medicine. My doctor actually wrote me, he says, I want you to get that prescription for the narcotics I gave you. I said, I don't want any narcotics. No, if I have any pain, I'll take regular over-the-counter stuff. I'm not taking any narcotics. I didn't want to get into that. No, I didn't want to, no. So, but they did give me a prescription for stool softener, bladder spasms, and antibiotics. Now I take all those. And of course you want to take the antibiotics until its jar is finished. So, I'm up and around. I'm not bedridden. I'm not trying to do anything. I am careful about this. The band is here, and so I'm walking around like this to keep the band close to the catheter so it doesn't pull it out. And then of course I have my bag under here. I don't want to show you the gory details, but I'm just telling you, I walk around like this holding my band so it doesn't slip down my leg. I don't want it on too tight. They probably need to develop something like a garter strap where it won't fall down. And some might. Mine doesn't. I'm eating regularly. I'm drinking a lot of fluid. I know how to empty the bags and everything. And you have a separate bag for night, a bigger bag for night, than you do for day. In bed, my wife fluffed up the pillow so that I could only turn one way, because you don't want to be sleeping on the side where your catheter is and your hose and get it kinked up or anything. I'm not sleeping well. I'm basically laying there, maybe falling asleep, but waking back up because of sensation to pee. But I'm resting, so I'm actually getting bodily rest because I'm laying there for 8 to 10 hours. But as far as actually going deep to sleep, no. Last night I did try some, I didn't want to take any harsh sleeping pills. So I did take some melanin, I don't know how to pronounce that. I have a lisp. Okay, so I just want to let you know it's been on 4 days, and I'll keep these videos going. And at the bottom or in the description, I will put videos of another gentleman who did a similar video a couple years ago. And I only found it the day before my surgery, but it really helped me right here. It really told me what I'm going to be going through, and he actually has a series of videos for 2 years, up to 2 years after. So I'll keep doing videos, but watch his too. And I'm giving you there's another video that I found interesting. There's all kinds of videos about prostate surgery on YouTube. So I'm just trying to help the next man out that has to go through this. I was given 4 choices. Surgery, seeding, which is radiation. They actually stick some kind of radiation beads into you, and you live the rest of your life with those, and it's supposed to destroy the cancer. Radiation probably was the less invasive, where you just go in 6 times, sit for 6 weeks, and you go in for half hour, 45 minutes, get shot with radiation, and then you live a normal life. But you still have the, and they gave me, 80, 90% effective and all that. But, talking to other friends of mine that have been through this, I decided to go ahead and get the surgery. I will tell you that the surgeon told my wife that he cut the prostate out. He didn't have to cut any lymph nodes. He didn't have to cut any nerves. I hope that's a good sign. I hope. And of course, in the months to come, I have to have other PSA tests to make sure it's down to 0. Did I tell you I cut the grass down low so that I don't have to cut the grass for 2 or 3 weeks? So, I'm just letting you know what I'm going through right now. Again, 4 days after surgery. This is what I've learned so far. Okay? So, and I will do other videos. So, in the bottom of the description, look for the other video because he's very good about telling you what needs to be done. Okay? And go ahead and subscribe to him with the bell, and that way you can get any other updates, because his surgery was 2 or 3 years ago, so he knows more than I do right now. That's it for me. Alexa, stop. I had her timed, so I didn't go too long. All right. Again, I feel fine. I'm wishing the best for myself. I hope that I'm cancer free. So I will continue to do these videos to show you what you may face. Have a blessed day.